This conference will now be recorded.
Good morning to all of you. Today we will discuss about the barbiturate poisoning, and with this the syllabus will be completed, theoretical part, and we have to tell about the practicals. So we will repeat the classes from the next week, or wherever possible we will tell the practicals also in online, and whenever you come to here we will show the practicals also. So coming to the barbiturates poisoning, there are three types of barbiturates: long-acting barbiturates, short-acting, and ultra-short-acting. So long-acting barbiturates are phenobarbitone, and short-acting is beta-barbitone, pentobarbital, and ultra-short-acting is thiopentone and methotrexate. So they are used in medicine as a medical also barbiturates. So uses of the barbiturates is a treatment of insomnia they use, and phenobarbital for epilepsy, and thiopentone for used for anesthesia, to give anesthesia, and they are also used in some psychosomatic disorders. So these are the uses of the barbiturates. Next, coming to the toxicokinetics. So these barbiturates, when you take, the metabolism occurs in liver, resulting in formation of alcohols, ketones, phenols, or carboxylic acids, which are excreted in urine. Acids are in the form of glucuronic acid conjugates. So these toxicokinetics, metabolism occurs in liver, formation of alcohols, ketones, and phenols, or carboxylic acids, which are excreted in urine. Normal fatal dose for barbiturates phenobarbital is 6 to 10 grams, emobarbitol, pentobarbital, and cyclobarbital is 2 to 3 grams. Lethal blood level for short and intermediate acting barbiturates varies from 3 to 4 mg per 100 ml. They reach 3 to 4 mg per 100 ml lethal blood level, so that will occur. So what are the toxic effects? If you take overdose of the barbiturates, what are the toxic effects? There is a slurred speech, ataxia, lethargy, confusion, headache, and nystagmus. These are the common toxic effects. The person feels slurred speech, ataxia, lethargy, confusion, headache, and nystagmus. So it's always a barbiturate is a CNS depressants. So generally they will cause you the overdose, cause more depression, and may go for coma and shock. People first constricted and dilated because of the hypoxia, and there is the hypothermia, death due to respiratory arrest or cardiovascular collapse. So toxic effects are slurred speech, ataxia, lethargy, confusion, headache, and nystagmus. This is CNA depressants and causes the coma and shock, and the pupils first dilates, first consistent dilates because of hypoxia. Again there will be hypothermia, death commonly due to the respiratory failure and also sometimes cardiovascular collapse. So chronic abuse. So frequently using, you may get tolerance, and then you have to take more dose. And so if you withdraw after chronic use, anorexia, tremors, insomnia, muscle cramps, seizures, delirium, orthostatic hypotension, this may develop. So after using the long period, and if you there is withdrawal reaction, there is anorexia and tremors, insomnia, cramps, seizures, delirium, and orthostatic hypotension. So coming to the treatment of the barbiturate poisoning, first of all, you have to give gastric lavage. These are a benefit up to within, if you do it in 6 to 12 hours of the post ingestion, and the activated charcoal can be given at usual dose, and forced alkaline diets is important. So you have to do forced alkaline diets is to be particularly helpful in the case of barbiturates poisoning. Next, common hemodialysis or hemoperfusion, and then you have to do symptomatic treat or supportive measures, supplemental oxygen, intubation, assisted ventilation, and IV fluids. So treatment is gastric lavage can be done with the 6 to 12 hours and activated charcoal and forced alkaline diuresis, hemodialysis and hemoperfusion, and supportive measures, supplemental oxygen, intubation, assisted ventilation, and IV fluids. These you have to give. Next, coming to the autopsy findings, generally normal findings, and then there will be a cyanosis, and you can see the froth at nostrils and skin blisters and dependent parts and congested lungs. And so, if you come to the autopsy findings, there are cyanosis and froth at nostrils, skin blisters on the dependent parts, congested lungs, and viscera. Coming to the forensic significance, the medical incidence of poisoning reducing nowadays. And Hollywood celebrity Marilyn Monroe also died due to overdose of phenobarbital. So they can be used as a truth serum also sometimes by the police officers. IV thiopentone is being used to extract confessions during interrogations. Attacks by inducing a drowsy and a disorientation state. So it can be used as a truth serum also. So with this, the barbiturate is over and the syllabus is also over. So just I will repeat the infant deaths just for 10 minutes. The important topic to oral aspect and also to the 4 marks questions and 2 marks questions. So when you call a infant, so birth to 1 year you call a infant, and birth to 28 days we call as a neonate. And infanticide, the unlawful destruction of a child under the age of 1 year is called infanticide. That's killing of the infant. From birth to up to 1 year you call as a infant. So if you kill that infant, it is called infanticide. That's feticide. It is killing of the fetus at any time prior to the birth. That is in the intrauterine life. So filicide, killing of a child by its parent, it is called filicide. Neonaticide, deliberate killing of a child within 24 hours of the birth. So if you kill a child within 24 hours after birth, it is called neonaticide. And if you unlawful destruction of a child or under the age or killing of a child under the age of 1 year, it is called infanticide. So if you kill the fetus at any time prior to birth, it is called feticide. And you call up to 1 year of the child, it is infant. And up to 28 days, we call it as a neonate. So what is stillborn child? It's a 4 marks question. A stillborn child is one which is born after 28 weeks of pregnancy. So it is a reputation. So by this time, you should know everything. What is viability? And like so, viability gets the entitled by after 28th week, that is 7th month. So after completion of the 7th month, a stillborn child is one which is born after 20 weeks of pregnancy and which did not breathe or show any signs of life at any time after being completely born. So, should be the child should be 28 weeks. That's why you will get the viability. Viability means separately can exist. So, but he is alive in interest, but during the process of birth he will die. So that is called stillborn child. So it is 5% incidence in a more frequently. So illegitimate found among illegitimate immature male children and we will generally seen in primary para, and also the signs of the prolonged labor edema, bleeding into the scalp, severe molding of the cause of stillbirth is generally prematurity, ataxia, and trauma during the birth and placental abnormality. So toxemia of pregnancy, erythroblasto fostalis, and congenital defects. Next, after stillborn child, dead-born child. So this is a born dead in the uterus. A dead-born child is one which died in vitro and shows one of the following signs after it completely born. That is rigor mortis at delivery and maceration and mummification. So maceration is the process of aseptic autolysis and requires 3 to 4 days of dead fetus inside uterus. Signs of maceration not found. If the child is born within 24 hours, even though dead, maceration will not be found. The child is born within 24 hours of death, or if air enters into the liquor. So signs of maceration are earliest signs is skin slippage and also gas in the great vessels and collapse of the vertebral column, loss of alignment and overriding of the bones of cranial vault. That is Spalding sign. This is again a 2 marks question. Spalding sign, loss of alignment and overriding of the bones of the cranial vault. So if you examine the macerated fetus, that is dead fetus and macerated fetus, it is very soft and flaccid, flattens out, sweet and disagreeable odor, skin is red, epidermis detached easily, abdomen distended, and bones and joints are flexible and abnormality is movable. So coming to the mummification occurs when the fetus dies from deficient supply of the blood or liquid amna is scanty, no air enters into the uterus. So after stillborn and deadborn coming to the live birth, it means that the child showed signs of the life and only part of the child was out of the mother. So after birth, it shows signs of the life. What are the signs of the live birth? So signs of establishment of respiratory. First is the shape of the chest. You have to see position of the diaphragm, changes in length. They are different before respiration and after respiration. So changes in the stomach and changes in the middle ear. Other signs of live birth are blood meconium, caput succedaneum, skin changes, umbilical cord, and circulation. First, coming to the shape of the chest. If you observe before respiration, that is before birth, the chest is flat. But if you take the respiration, after respiration, chest is arched or drum shaped. So position of the diaphragm. The highest point of diaphragm dome of it is before respiration, the position of the diaphragm is related to 4th to 5th rib. But if you rest after taking respiration, the diaphragm goes down at the level of 6 to 7. So changes in lungs, the color dark red in color changes into moderate pinkish or reddish in appearance. So before observation, the color of the lung is dark red in color, changes into mottled pinkish or reddish in appearance. Weight is before respiration 30 to 40 grams of the lung, but after respiration is 60 to 765 grams. It is called static test or foetus test. So flow gets test. Before respiration, after respiration, the weight of the lung is in relation to the body weight. So before respiration is 1 by 75 of the body weight, and after respiration it is 1 by 35 of the body weight. That is called the flow gauge test with the weight of the lung. Next, coming to the consistency, it is a non-cryptant liver-like appearance. For respiration, changes into soft and spongy cryptant in appearance. So volume of the lung is before respiration small in size, based on the uppermost part of our either side of the vertebral column prior to respiration. But become increased in volume and almost fills up the thoracic cavity after the respiration. Next, margins of the lungs are sharp margins before respiration and become respiration. After respiration, they will become sharp margins and cut section, little froth, less blood exuded prior to respiration. But after respiration, abundant frothy fluid exits. So air vesicles, lungs which was eclectic and airless become expanded and air vesicles appear on the surface. Coming to the hydrostatic test, or it is also called Vegas test. It is a 4-marks question. If breathing established, volume of lungs and specific gravity, you have to see. Principal specific gravity is 1040 to 1050 if not established in the respiration. If respiration established is 940. So procedure already you know, lungs removed from thoracic cavity, which attached bronchi, and you have to tie the ligature and bronchi and lungs separated. Each lung individually is placed in water. So a small piece of liver take also as a control and it flows out into 12 pieces against placing. If the lung flows in the water, you have to cut it to 12 pieces again is placed in water. Even then, if lung pieces are floats, then squeeze it with pressure under water, bubble of air escapes. Still floats, it indicates the taken out wrapped in a piece of cloth and squeezed by putting weight to remove it. If still it floats, respiration at table. So in small amount of air present, it will floats. So that indicates the respiration has taken place. So false positive sometimes expanded lung may sink. So even the respiration is taken, the lung may sink sometimes because of acute edema of lung, pneumonia, atelectasis, obstruction of alveolar duct membrane. Sometimes unexpected lung may float. So purified lungs and artificial inflation by artificial respiration. These are all the false positives. The test is not necessary. The fetus is a monster or the fetus born before 180. That means the viability will not come. Fetus is macerated or mummified means it is a dead fetus. And stomach contained milk itself indicates it is a live one. Say umbilical cord has separated and scar has formed. Change in the stomach and intestine. Air is swallowed into stomach and intestine during respiration. So it's a sign of the live-born child. So if air in the stomach present, the test is known as air in the called breast loss second life test and also stomach ball test. So The air in the stomach is an indication of live birth, and test to know air in the stomach is called Breslau's second life test or stomach bowel test. So, how to do the procedure of test for to do the Breslau's second life test or stomach bowel test? The stomach and intestine are removed after tying double ligature at each end. So, you have to tie the ligature at both ends. If they float in, you have to put in water. Then, if they float in water, indicates the test is positive. That is the live birth. So, milk in the stomach is one of the positive evidence that the child has survived for some time after birth. It shows some presence of milk in the stomach itself indicates as it's a live-born child. So, change in the middle ear, that is called a readiness test. So before birth, middle ear contains gelatinous embryonic connective tissue. So before birth, the middle ear contains gelatinous embryonic connective tissue. So, but after the respiration, middle ear contains air. The gelatinous embryonic connective tissue will be replaced by air. So that is called readiness test. So other signs of live birth, blood nucleated RBC usually disappear from the blood within 24 hours, and the fetal hemoglobin just before birth 80%, and after birth it decreases to 7% at the third month. So meconium. So what is meconium? It is these are all 2 marks questions. Meconium is the green viscid substance consisting of thickened bile and mucus. Meconium formed due to the bile and mucus, that is called green viscid substance consisting of thick bile and mucus. After birth, the first 24 to 48 hours, it is completely excreted from the large intestine. Color of meconium is brownish green in color. Reaction is acidic. So that is meconium. Sometimes the meconium may be excreted before birth in certain conditions like presentations and ataxia. Let's apply hematoma or caput succedanum. This is also a Dumas question definition. This is an area of sharp swelling. The swelling present. This occurs during the birth. This is an area of soft swelling that forms in the scalp for the presenting part of the head into a text presentation. So in the text presentation, there may be possible a spot swelling that forms in the scalp for the presenting part of the head. That is called caput succedanum as a hematoma. Site the portion of the scalp within the opening of the eyelid cervix during labor, and mechanism is localized edema due to local interference with venous return produced by the pressure of the cervical electricity, obstruction of the venous return by the rigid cervical thing. So characteristics of the caput succedanum is it is asymmetrically over crown of the head, in the parietal. Generally, you see this in the parietal region. So you see that is the caput succedanum. It will gradually disappear from the, you need not do anything, it will gradually disappear from the first day in 1 day. Next, coming to the haplohematoma. So this is a localized recognition of blood deep to scalp between the periosteum and surface. This is because of the birth injury during the trauma. This is a localized recognition of blood deep to scalp between the periosteum and bone surface. The characteristic features are limited to periosteal sheath of a single bone. Common site is the right parietal bone again, never calcium suture line. The incidence of is less than 1% cases of newborn. Size varies from 1 centimeter to 5 centimeters or more. Hematoma is increases in size in first day after birth and gradually disappear in subsequent weeks as the blood is absorbed. Sometimes it is aggravated The physiological jaundice of neonatal is because of the extra load of blood. So coming to the skin, color of the skin is bright red just after birth, become normal in 1 week. Physiological jaundice sometimes in certain cases it appears in the third day onwards, and it is due to relative insufficiency of enzymes required for conjugation and excretion of the bilirubin. Next, coming to the vernix caseosa, it is a secretion of the sebaceous glands mixed with the exfoliated epidermal cells. That is, the secretion of the sebaceous glands and exfoliation of the epidermal cells. It is vernix caseosa. It covers the skin in axilla, inguinal region, neck fold, and buttock. Vernix caseosa persists for 1 to 2 days. Exfoliation of the skin is for 2 to 3 days after birth. The umbilical cord changes after birth. Inflammatory ring at base 36 to 48 hours, swells in 2 to 3 days, fall off in 5 to 6 days, cicatrizes 10 to 12 days. So if you examine the application centers, calcaneum appears at the 5th month and 4 division of sternum 6th month in intrauterine life, talus 7 months, lower end of femur, you can see the 9th month. At birth, cuboid and upper end of. So the generally aspiration looks like brownish red nucleus, which is surrounded by a bluish white cartilage. So with this, today we completed the syllabus, but we start some important topics, repetition, and also some points of the practical aspect from the next class. Thank you.